Carole Osborne, and I've been a practicing body worker since 1975, which has given me a lot of opportunity to work on many different types of clients. I'd like to today focus on the use of the sideline positioning system as an excellent tool to accommodate some special people who have special needs. Pregnant women, and we'll talk later about frail and elderly clients, how to accommodate those who are overweight, and also to look at how post-surgically this equipment can be really helpful for you. So first of all, Karen here at 25 weeks has this delightful belly here, which would be quite compressed if she were to be laying in a prone position, and she might find the prone position to be uncomfortable on her breasts for sinus pressure and maybe even straining her lumbar area. So this sideline positioning gives her the advantage of a safer and more comfortable position. It's a stable way when she's supported on firm cushions like these that will accommodate the contours of her body, and also that will support her abdomen. You can see that her abdomen's supported on the cushion, and I also added just a little folded sheet right in here to take care of this lower part of her abdomen. And this makes for a neutral alignment, particularly if I pay close attention to that belly support. And notice that I used enough supports to get her hip, her knee, and her ankle even, so that she's really in a neutral position on her side and doesn't have to hold herself in this position. Some women are more comfortable with these supports between their knees, and this system is made with a little cutout section in the bottom of this leg bolster, so it fits nicely between the legs. This system also can accommodate a pregnant woman who might be having heartburn or who might be more comfortable in the semi-reclined position, and using this strap that's inserted into the hinge of the table and reconfiguring these structures, you can bring her into a semi-reclined position, and we'll show that later on in the video. So another group of clients with special needs are those who have postural differences, those who are perhaps frail or elderly, and the sideline position, particularly on this system, can be really helpful for them. A couple of things. First of all, sideline, no pressure on the face on delicate skin, and less pressure and delicate skin throughout the body as we press on the posterior structures. That's a great advantage. Another great advantage is that this position can accommodate for things such as the slight kyphosis that Kathy has here. And so she's not uncomfortably in a supine position or a prone position. And in fact, if I even further adapt the way this cushion is used and adjust the headrest forward, that's a little better for you, right?
Yes.
Yeah, okay. We've also been able to use this to adapt to her leg restrictions here. Have a knee that's really uncomfortable to be bent, so we've skewed the position of the leg bolsters and supported her legs so that's comfortable for her. And finally, oftentimes folks who are a little older have more difficulty breathing in the prone position. And so this position is an excellent position to help her to be able to let her rib cage open and close readily. Another client who can have special needs are those who are overweight. And so the semi-reclined position can be very advantageous for them. It makes it easier for them to breathe, and oftentimes they have a bit of heartburn as well. So what I've done with the sideline positioning system now is I have taken each of the individual components and constructed them and supported them with the strap that comes around the table, and there's hooking on this other side as well. And so this creates a very firm support. You notice that while it compresses and provides some softness for Russ to lean against, it's also quite firm. And you're feeling pretty secure up here, right,
Yes,
Russ?
very, very.
Okay, great. So this is a great position then for him. It's easier for you to breathe. And do you have a little bit of tendency towards heartburn at times? So this is a better spot for you as well, right? Now we can also use some of the other pieces that go with the system. We can use this small wedge. If he needed some more adjustment of his head and neck, I could use this little wedge behind his head, or if we needed to support his feet and his legs a little more, we could shift that up here. And I've put that small pillow underneath his knees as a knee bolster. Pretty comfortable, huh?
Very.
Good. Another group of clients who can be made more comfortable with the sideline system is those who have had recent surgery, particularly any abdominal or chest surgery. Bob has had a recent hernia, and so he finds that the more fetal-like position of the sideline position is more comfortable, and I've made that even more comfortable for him by putting this bolster between his legs, by allowing him to have his hips greatly flexed, and we've put a pillow support up in front of his chest so that again puts a little more comfort. The sideline position means that the incision areas of any of these types of surgeries wouldn't be compressed against the table when we were working on the back. And oftentimes a post-surgical client is going to have a great deal of need for mobilization of the spine and for work along the erector spinae muscles, all of the areas that would be uncomfortable if I were to press down on his body when he were in a prone position. This also is a great position for accommodating ports and monitors that might be attached if someone were in hospital. And so we can have those ports free and not being pressed in the prone position using the sideline. This also is a great system to adapt, as we did earlier, for semi-reclined position, because some post-surgical patients really feel like they need help with their breathing. So you can see by the various clients that we've brought through here that there are many ways to adapt the system to accommodate for those who are pregnant, for those who might be frail, elderly, those who are overweight, and those who are post-surgical. Thank you.